an actual specific protocol. We have an amazing package deal if you're interested in this protocol where you get the device, all of the products that you need, and you also get the nano stamp. So it's an amazing deal, and we can tell you a little bit more about it later. But we're going to start with our first cleanse, and that's going to be using the Mega Rich Antioxidant Cleansing Gel. Michael, tell them all about it.
Thank you, Elizabeth. So this is a great first step cleanser. A gel cleanser is ideal. This is the job of this cleanser is going to be to remove the makeup, remove dirt, hydrate the skin.
Try to put the mic a little closer to you.
Start to deliver antioxidants.
There we go.
So we're not doing any stripping, exfoliating yet. This is really that preliminary cleanse. And even with this initial cleanse, you're going to start to see her look hydrated. So cleansers are often overlooked. And I think a lot of companies make cleansers that are too stripping. And I don't mean exfoliating, I mean stripping. So these are plant-based cleansers. No synthetics and no petroleum in these products.
Do you want to tell them a little bit more about how M.A.D Skincare is set up with your color system and all of those details while we do this cleanse?
So the cleanser, we'll start with that particular category real quick, has a big red stripe, and anything with a big red stripe is going to signify it's in the environmental category. So this is really focused on cellular health, protection against airborne pollutants, floods the skin with antioxidants, and gives you generally overall a healthy skin environment. Other products are going to be for acne, so they're going to have a blue stripe, anti-aging is purple, delicate and sensitive is green, hyperpigmentation is going to be orange. So you're going to be able to navigate throughout the line. If you happen to see a bunch of M.A.D products, kind of look for the color code, and you'll get a good idea of...
I mean, they also have pretty good names.
Yeah, they're kind of self-explanatory too, which is true. I like to keep things simple in that regard.
So now I'm going in with the second cleanse, and that's going to be our first kind of light level of exfoliation, and that's going to be with the Mandelic Refining Cleanser. So this is part of your Flex line, and we can see lots of different colors on here.
Yeah, so we introduced the Flex line because it's utilizing mandelic acid. Mandelic acid is great for 3 types of skin concerns: acneic skin or oily skin, hyperpigmentation, which means it has a brightening effect, and of course anti-aging because it's an alpha hydroxy acid. It's going to really start to alleviate fine lines and wrinkles. So notice the tiny bubbles on the skin. They're not these big ginormous amounts of suds. Okay, these are plant-based cleansers. They're a little gentler, a little more refined, and they all perform different specific functions. A cleanser is not just a cleanser.
Well, I feel like cleansing really is a step that we sometimes don't take enough time with.
Mm-hmm.
And it's essential for everything else afterwards to go well, you know?
Yeah, exactly. So if you start cleansing with the incorrect cleanser, you're going to get a diminished result further down the line.
And I like this cleanser a lot before I'm going to do treatments that are a little bit more involved or that require a little bit more from the skin, because it's going to degrease the skin and really allow and remove any oil or any buildup and allow for me to get better penetration of whatever it is I'm going to use afterwards.
So those 4x4s are coming off with makeup, dirt, all kinds of goodies that don't need to be on the skin, but they're ready to do it. And she's already starting to look hydrated. I love their heart shape. I never noticed that.
Yeah, they're heart-shaped purple sponges, you know. All the branding, Michael, all the branding here. We have to be cute.
This is a water rinse, right?
Yeah, just a water rinse. I like with foaming cleansers, sometimes the foam can live forever. So I really like with foaming cleansers to take off some of the foam with just dry 4x4s first. and then go in with a sponge with water.
Foam can live forever.
Yeah, I just like to remove it a little bit with just some dry 4x4s. That's a tip I learned a while ago, and that was really helpful. It's helpful to me.
Really hydrated, looking really good.
Ma'am, can you close your eyes, please? Thank you very much. She's one of those clients.
I have to see what's going on. I have to see.
All right, so now we're going to go in with Everyday Renewing Toner. I'm going to give you some sheets with a little bit of it just so you can pass it around so everybody can kind of smell it, see it, feel it. It smells lovely.
So it's not fragrance, this is just botanicals that are infused into the Everyday Renewing Toner. It's a rich hazel-based toner with 5% multi-fruit acid and a bunch of botanicals for an antioxidant benefit. So antioxidants are really key to help fight free radicals, and a little bit of multi-fruit acid is helping to dissolve more dead skin. And again, we're just continuing some light exfoliation. These are two good prep steps before you get into any sort of either acids or enzymes or whatever you're using.
And now this toner, Michael, is a toner that's good for pretty much anybody, right?
Anybody, even delicate and sensitive, acneic, anti-aging, hyperpigmentation, it doesn't matter. Perfect.
So the next thing I'm going to do is just kind of dry her skin out because we're going to start with our peels. So I don't want anything to kind of be in the way. All right. But her skin looks amazing, and we just started, you know?
Looks very fresh.
So now we're going to go in with our first layer of exfoliation. I don't know if you guys can see that there. That is going to be the Multi-C Retinol Peel. Now, this is one of my favorite peels, and I have yet to see another brand that has vitamin C and retinol in a peel format. Talk about that. The pH on this is a 3, so we're going to be, on a scale of 1 to 10, the spice level is going to be somewhere around 4 to 5, and we can ask you in just a moment, okay?
Yeah, so this is one of our peels in the M.A.D peel line. Again, like Elizabeth said, let's see why, because vitamin A is retinol is excellent for cell turnover. Vitamin C is excellent for anti-aging.
Really quick, I just want to show you, this is, I mean, more than enough. Okay, so very, very not, I don't know if you can see that. A very, very small amount is what you need.
And it's in a cocktail of multi-fruit acid, lactic, and a little bit of glycolic. Not a lot, just a little. So this peel is not meant to shed your skin. These are more on the lighter side to deliver the active ingredients deeper than if you were just putting a vitamin A cream or serum on your face, or using a 40% cocktail of acid to help really drive it down. So if you want to take a look at that, you can pass that around.
And you know, with skincare formulations, it's one of the things that we've realized is that there is no need to have a super high percentage of one acid to get beautiful results.
No.
You'll get really great results having combined acids like this in a much more gentle fashion. You know, they help each other function better. Now, she does have a little burn up here, so I am skipping that part with the application of the peel. Now, Deanna, on a scale from 1 to 10, what does it feel like?
Feels good.
Like a scale from 1 to 10, 10 being super duper spicy.
Probably a 2 or 3.
So she says she feels it at a 2 or a 3, okay? So it's not going to be something that is super duper intense. And we don't want it to be, because what we are doing here is we're doing several layers of exfoliation, but each layer is going to be gentle, okay? That is going to give us beautiful results, great results, positive results. Our client's going to leave happy. They're going to get even long-term results without the downtime, okay? So really, really, it's important to think about it that way versus being super aggressive all at once. Now, this peel on its own You can also use it on its own. Like, let's say you're not doing the Miami facial protocol and you do layers of it as well, right?
Absolutely. You went through 2 or 3 layers. You would separate them by about 5 minutes to 7 minutes in between your application of the layers. Or
So-
you can even cocktail it with.
So now we're going to go in with our second peel. Do you guys see that there?
Yeah.
Okay.
Genesis,
It's
yeah.
going to be the Genesis Growth Factor peel. Now this has a slightly lower pH where we started with
The 3.
the 3. Now we're at a 2.5. So just slightly lower, very similar ingredients. One of the really cool things about
Sorry, you could just put the product by her cheek, like right here. There you go.
Oh, okay. So one of the really, really cool things about M.A.D Skincare that I think is important for people to know is the ability to layer, mix, match, do massage.
Fusion.
Yeah, like,
You could do mad press, where if you have a Q-tip and you have some stubborn spots, you can twist in some product. Like I do that here. I have some hyperpigmentation, generally speaking, right on this orbital bone in my eye. So I'll take one of the M.A.D peels and I'll dip it and I'll press right on the spot. Because I don't have hyperpigmentation or super elevated amounts of hyperpigmentation in other areas. So I like to do what we call mad press. Now, what's cool about this peel is 3% growth factor complex. It's a plant-based growth factor. Basically, that just means it's an amino acid complex really designed to minimize wrinkles and brighten the skin. Yeah, it went around. Anybody know where the multi-C went?
Yep.
Nope, there we
Thank
go.
you. They're asking on Instagram. Sorry.
hello,
No,
Instagram.
hi, Instagram.
Why aren't you in IECS in New York? Am I going to see you guys in Vegas? Like, where are you at? Where are you?
So the logic behind what we're doing by putting the active ingredients in with the acids is we're going to use the acids as like an express
that
elevator down.
Okay, still around a 2 or 3 or a little bit more?
Lower.
The
Perfect.
epidermis with the acids. What follows are going to be those active ingredients. So they're not just sitting up on dead skin. The acids are acting as an exfoliator
And a
delivery
vehicle.
system. Yeah.
I love that. I think it's so unique. Also, when have you seen peels that have growth factors, vitamin C, retinol, all in like one
Right.
place? Like, think about all the actives that we're putting on the skin. Think about all the things we're infusing into the skin while helping it to, rejuvenate at the same time.
Yeah. So these growth factors and stem cells are critical to increase that communication to drive new skin growth. Because what happens is when we age, the fibroblasts aren't communicating to signal new growth. There's the gap. So amino acids, which is what makes up plant-based stem cells and peptides, are basically just a bunch of mouthpieces. Hello, let's go. Start.
Activate.
Activate. Go. Yeah. Really critical.
All right,
And
so,
the antioxidants, real quick,
yeah.
are what are going to bind to the free radicals, and that's what's causing the miscommunication. So antioxidants are going to neutralize free radicals so that the fibroblasts can do a better job of communicating because now they have the amino acids to stimulate that communication.
All right, so now I'm going to do one of my favorite things to do with M.A.D, which is a really special M.A.D hack to neutralize. So we are going to do what is called a slow neutralization, which basically means that instead of going right for the neutralizer, we're going to raise the pH slowly. So I'm going to start first with 4x4s with Everyday Renewing Toner. So there's that Everyday Renewing Toner again. And that's going to be our first kind of way to bring up the pH just slightly. You want to talk about that?
Yeah. So from the peels, the customer, the client's skin is around a 3.5 pH. So we don't want to jump it all the way to a 9. The Everyday Renewing Toner is about a 4.5 to about a 4.5 pH. So this is going to bring the pH up a little slowly. Do you ever notice when you're doing chemical peels and you neutralize them, you kind of activate that whole system where the
You have an
client's
yeah.
skin gets shocked?
Well, you also have like your skin has an increase of activity before you get that lowered activity.
Yeah. So this is, again, going to minimize the response. We want to keep the response under control.
Yeah, and it's just going to make it more pleasant for the client. Now these are 4x4s with just distilled water.
Right. So water has a pH of around, let's say, 6, 6.5. Again, you're bringing it up slowly. So it's funny, we did an express elevator down with the acids and the actives, but coming back up, I want to do a little more slow. Okay?
Now is when I'm going in with the neutralizer, okay?
So this is a pH of around 9.5. So the idea is you're closing up everything. Okay, you're rebalancing, you're neutralizing any of the acids that might be sitting in the nasal area or the parenthesis lines or near the
She doesn't
eyes.
have any of those. What are
Right,
you
no,
talking
her
about?
skin is really good, so she doesn't have parenthesis lines. She's got dimples.
Yeah, she
She's got
does.
dimples. So our neutralizer is,
You still feel any
it's a
activity
nice
anywhere?
cocktail of oat
Feel good? You don't feel
oats, unknown,
acids
some
anywhere?
skin calmers,
No?
some licorice and other skin calming ingredients, anti-inflammatory ingredients. So we're controlling the inflammatory response. That's going to control any chances of post-inflammatory hyperpigmentation.
It's also really essential to control that inflammatory response when you're going to do a multi-level treatment like this, okay? We don't ever want the skin to get out of our control, okay? So it's essential to balance things as you're going, watch the skin as you're going, and we give you a protocol, guys, so that you can follow the steps, but there is no replacement for your expertise, okay? So if you see things happening that you don't think are supposed to be happening, then we need to take a step back, we need to slow down, and we need to figure out what we're going to do to make it fine. But so far, her skin has responded beautifully to the treatment. Okay. So we have neutralized. I did check with her to make sure that she didn't feel any sort of irritation or any sort of activity still anywhere from the peels. Now I'm just going in with a dry 4x4, making sure that the skin is dry. You definitely could also go in with a little bit of Everyday Renewing Toner if you wanted to at this point. Mm-hmm. But now we're going to go into our Hydrodermabrasion step. So again, this is our, I guess, third level of exfoliation that we're going to do. But everything is done gently. So we are using our Aries, could you plug that in for me, please? Aries Hydro and Micro. And we are using our silicone tips. So these tips are soft, pliable. We use them in every treatment to do extractions. And we also use them in treatments like this. You could do this with dermaplaning. You could do this with just microchanneling. But since we're doing a microchanneling, a peel, other things, sorry, I need to put on a rubber band. This happens to the best of us. Very important part of making sure that your machine is working properly. But it will help you to do that exfoliation and give your clients the benefits of that exfoliation without overstimulating the skin. So we're going to go in, you just turn your head this way, and we're going to go in and just do some light kissing. And I think my flow is up a little too high. And we're just going to glide across, making sure to pick up any solution that might be left when we lift the tip. Now what we want to do is bring that solution back to where we're going to glide next time, okay? What that's going to help us do is make sure that the skin that we are going to use the hydro on is moisturized or wet so that we have better glide of the device, okay? Now you see how she has a little bit of redness going on? That's totally normal, guys. We are stimulating a lot of blood flow, and there's a lot of stimulation just happening with just this device. I'm going to get really kind of close in here. In here, I have our Hibiscus Fix serum. The Hibiscus Fix is for drier skin types, but it is a lactic acid base. It has lactic, malic, and azelaic acids. along with licorice and calendula extracts. The reason why I chose this is because it's an acid that's going to work with all of the acids that we used before. They're all friends. So you can use this one. The other one that would work really beautifully would be the mandelic. That would be a great option as well if you have somebody that's a little bit more sensitive, or maybe somebody with a higher Fitzpatrick skin type that you'd want to use that larger molecule for the mandelic. But the hibiscus fix is beautiful. It's really nice. It also has hibiscus flower extract, which is very high in vitamin C. So it's going to be really helpful for your clients that need some help with pigmentation as well. The other really beautiful thing about this silicone tip is you're not over exfoliating, right? So you're really controlling the amount of physical exfoliation that's happening. Now, I want you to notice this side where I just stimulated her is a little bit red and pink because blood flow. Blood flow is one thing,
Right.
Irritation is another, inflammation is another. This is blood flow, and how do I know that? Look at this side. Okay? This is from stimulation. This is after her skin has relaxed and that blood flow has come back. Now I'm going to go in and do a second pass, okay? Yesterday, we did the same facial, and we had a different model, obviously, because you don't want to do this on the next day on the same person. Hello. But we had a different model, and she was a little bit too pink right after we finished that first pass. So I made an executive decision, and I said, I'm not going to do that second pass because I don't want her to be too red or too irritated because we're going to continue to stimulate after this. So I went ahead and just did the one pass and did my extractions. So that's what I mean, that in the moment and when you're in your treatment table and when you have the client in front of you, it is okay to make some executive decisions. We want executive decisions. That's what we went to school for. That's why you have a license and they don't. So you know better always, and you know your clients and their needs. So make sure that you are aware and not just following a protocol, that you're also taking action to make sure that your client's skin is in its best health, no matter what it is that you're doing. Okay? So as you can see, her skin looks so good. Now it is perfectly fine to glide in shorter glides like this, especially in areas that have a little bit more tissue, or if we have, not that this is your case, but if we had more mature clients with thinner skin, it's a little bit more fragile, you definitely want to work in smaller movements versus long movements. It's going to make the treatment much more comfortable for them, okay? So now I'm just going to do her nose. These are not extractions, we're just exfoliating. I'm going to extract afterwards. Okay, can you pick up your lower lip for me? Oh, no, in. There you go. Beautiful. Okay. So now we're going to do some extractions. I'm just going to do her nose, but before I do that, I'm going to use my bestie. This is my bestie. Guys, I love this product. It's probably it's a product I can't live without. It's called Extraction in a Fraction. Michael, tell them all about my love.
Sure. So this product is really designed to make your extraction process easier and to make it more comfortable for the client. And what it's going to basically do are a couple of different things. It's going to decrease and decongest the pores, but also importantly, it's going to dilate the pore. What does that mean? It's going to make it get a little bit wider. And that's okay. It's not going to stay wide for very long. It's going to dilate it so that when the extraction does the sucking up, that material in the pore has room to evacuate. And that's what makes it so beneficial.
Yeah, and so with the hydro, we're only going to do extractions in the T-zone, so in the forehead, nose, and the chin. We're never going to be doing it all over the face, and definitely not in the cheeks. Now, you 150,000% could do this, could do manual extractions or use an extraction tool if you needed to on the cheeks. But it's not, we wouldn't be using our handies. Why? The cheeks have more tissue, right? They have the issue that's, or what's going to happen is we're more probable for us to leave a mark on the client's skin. So we want to make sure that we are able to leave our client's skin beautiful, refreshed, glowing, maybe a little stimulated, but we don't want to leave them, beautiful swirl marks on their cheeks. That's not the look we're going for, guys. Okay? So we want to make sure we only do it in areas that are a little bonier, that can resist the movement of the handpiece. Now, with the extraction and diffraction, you could put it in the cheeks and it'll help you do your extractions there. So what I like to do is I like to kind of, you saw me kind of put it in the areas I'm going to work. I'm not really going to do anything on her forehead. She doesn't really have anything to extract. So that's also a point I like to make whenever we're doing hydro. Please do not, just because you can do it on the forehead doesn't mean you need to. Okay? If your client doesn't need it, don't do it. So she doesn't need it on the forehead. That's why I placed it right on her nose. And what I'm going to do while I work on the nose, I'm going to go ahead and place this on her chin. Now, it's not necessary to hold it like this.
No, but I think that's a really good hack.
So, but it's something you could just place on the skin and it would be fine.
I think that'll actually speed up the absorption rather than just having air contact.
All right.
That little substrate is great.
So what I like to do, our extraction technique is going to be more of a twisting motion. Are you okay? Does that hurt?
Yes, but I'm okay.
Does it hurt more than if I was doing it with my hands? Thank you very much. That's all I got to say. And we're just going to do some twisting motions like this. What that's going to do is allow the handpiece to really suction, vacuum, and allow for those sebaceous filaments and little blackheads that we might have there to come out. Now, you don't have to use very much pressure, but you do want a medium amount of pressure so that you're able to really get good contact with the handpiece. A little bit more right here. Now these silicone tips are nice because you can go over the same area. So pick up your lower lip for me. You can go over the same area a couple of times without over abrading the skin. You do want to twist, but you want to make sure that you're moving. We do not want to sit in one area for an extended period of time. Again, we're going to leave our client with a beautiful mark that we don't want her to have. Okay? A little bit of redness, totally normal. All right. So now we have done our process. Michael, you're going to have to, or I can give you my microphone, Carla. Mike, and Mike, Carla.
He's going to unmic me.
So now her skin is clean. It's been deeply exfoliated. And again, we use that silicone tip. So now my dear friend Carla is going to come in with her fabulous nano channeling device. That's the NanoStamp 360. Are you going to take mine? Okay. Say less. Oh my God. It's the hair. It's the hair.
Yep. Just be careful on the way out here. Yeah. There you go. Just a little test. Go ahead. Hello. Yeah. Okay. Lots of moving pieces here. All right. Okay. Thank you.
All right, so guys, now we're going to nano stamp, Carla.
Yes. So
now that I have a really well prepped canvas, I'm going to do microchanneling with the NanoStamp 360. All right. So before I start, I'm just going to wipe down her skin. I know it's really clean. Elizabeth did a really great job. I'm just going to come in with a little bit of hypochlorous acid and wipe her down.
And all that's going to do is create
Yeah.
Go ahead.
It's hypochlorous acid. If you're not familiar with it, it's a skin antiseptic. So it's very gentle on the skin. It's as gentle as water, but it is as effective as bleach in killing any bacteria on the skin. All right. So, oh, I'll get that right away. All right. So because she's already had a peel, she's had the Hydrodermabrasion and everything, I am going to use a 0.25 tip for microchanneling her skin today. Again, as Elizabeth has said many times, our goal is to stimulate the skin and not cause a lot of inflammation. So the 0.25 is perfect for this because we're layering a lot of different treatments and modalities in here. The NanoStamp does have an option to do nano infusion, so non-invasive nano infusion. If you're not able to microchannel, that's another great option that you can use. But for her, we will use the 0.25 microchanneling tip.
It's scary.
Take it off.
Yeah.
Take the top off.
I'm gonna
Take your
hold the
top
bottle.
off.
I'm gonna hold the bottle.
Sorry. Can you talk
I'm
about
gonna hold the bottle.
the area of the triangular tip?
Oh yeah. So with the NanoStamp 360, I do have, it's a larger tip than your standard microneedling tip. So although it's larger, we do have the patented triangle shape. And the purpose of that is to allow you to get into smaller or hard to reach areas, even though you're using a larger tip. You'll see that when I start working under the eyes, around the nose, how nicely that fits in there. I'm going to be using the M.A.D SYNPLA, M.A.D Platinum
Hello.
SYNPLA serum for this microchanneling.
Yes. Sure. Oh. So
Thank
we
you.
have three new SKUs that are
Sorry about that. Sorry, the syringe went a little bit faster than I anticipated there.
that are designed on a synthetic placental growth factor platform. What does that mean? So basically, that means we understand and recognize that the placental growth factor of the human is ideal to stimulate epidermal growth, and that's what's going to drive younger skin. But we didn't want to use human-based tissue or bovine-based or sheep-based tissue to utilize the growth factor. So we have a raw material supplier that takes vegetable-based amino acids, 23 of them, brings them into the lab, and is able to construct a placenta growth factor model. This is critical because now you've got a more perfect growth factor, and it's 25% more effective than human-derived, believe it or not. So what are we using, anti-wrinkle?
Elizabeth pulled it.
Anti-wrinkle.
Okay.
So we have an anti-wrinkle growth factor serum. This is going to be, of course, ideal for fighting lines, wrinkles, and reshaping and rebuilding collagen so that you get your tone back, okay? We have the bright growth factor serum, and we have one for hair regrowth, believe it or not. So that are for three different formulations. It's also, this is a 3% growth factor. It's also then combined with 3% hyaluronic acid, low, medium, and high molecular weight hyaluronic acid. And stamping away with, what's the size tip?
0.25. I'm using a
0.25.
0.25 tip.
So you don't need a numbing cream with a 0.25. How comfortable are you with that?
How you doing?
Pretty good? Good.
Good.
She's good. Carla, and what kind of penetration are we getting with that tip, and why is the 0.25 very good for this protocol?
Yeah. So I am using a 0.25 because we mixed, we've got a peel in there. We did the hydrodermabrasion, and I'm just giving a little more stimulation to her skin and inducing some collagen production. I am uh, I am using the 0.25. You could use a 0.5 if you wanted to, but I like to go nice and easy. And again, controlling that inflammation.
Now, with the 0.5, would you recommend a numbing cream? Or 50-50, depending?
Yeah, with a 0.5, so numbing is always optional. It's always going to be at your discretion. I do recommend it at a 0.5.
I'm going to sneeze, I think.
What was that?
I think I'm good. No, I'm good.
Oh, you're going to sneeze?
I was going to.
Okay, she might sneeze. There's a nerve up here by the eyebrow that sometimes you can trigger and it will make your client sneeze. So if you need to, let me know. Um, Numbing is always optional, but with the 0.5, I do recommend it because if your client is comfortable, they're going to be more excited to come back the next time. 0.25, always optional. Most people don't need numbing with the 0.25. So what the device is doing, so you guys see I'm going up and down, I'm stamping on her skin, but the device is also moving this tip up and down. So it's not just vibrating, it's actually moving it up and down at a very rapid rate. So it's doing most of the work for me. And I am stretching the skin a little bit. You don't need to have a very strong stretch, but you want to hold the skin a little bit taut.
So because we're dealing in millimeters, which is really not a very long distance if you think about it, those first steps we did with the M.A.D Skincare protocol is really eliminating a lot of dead tissue or partially dead tissue out of your way. So you're really getting a better depth, right? Because now you're really focusing on the living tissue.
Yeah, so that's why you're even at a 0.25, we're getting a much better treatment here because, as Michael said, we've eliminated all the dead tissue on the surface. And as you can see, my goal here is for her skin to turn pink. I don't need it to be very red. I don't need to see blood or anything like that. There's no blood right here. We're just stimulating the skin. So our goal in all of this is to stimulate the skin. We don't want to cause a lot of inflammation. Inflammation is actually pro-aging, so the goal is to be more in stimulation versus inflammation.
Yeah, we're straddling that line perfectly with this protocol. That's why it's designed the way it is designed. It's going to straddle that perfect line.
So here, I'm going to go on her orbital rim. I'm going to pull the skin down just a little bit, and you'll see right here, this is where that triangle tip works really nice.
Yeah, with a round tip,
right
it's really difficult to get that precision.
Under the eyes, you don't need a lot. I'll do like 2 quick passes, and that should be more than enough. The skin there is much thinner than the rest of the face, so you don't need to do as many passes on there. The amount of passes you're going to do when you're microchanneling really varies from client to client. Again, what you want to do is see the skin turn pink. So the amount of passes, like I said, it varies. What you want to do is read the skin. As soon as you see the skin turn pink, you're good. You don't need to do much more than that. So I don't know if you guys can see that on the screen there, but you can see like where I've gone. It's a little bit more pink versus the area that I haven't microchanneled.
So we're really incorporating synergies and devices from different manufacturers, whether it be skincare, the nano tool, the DermaJEM device, because they synergistically all can and do work extremely well together. And then the sum of the parts is greater than each of them combined. It's just going to be amazing result.
I'm going to go back on depth. So we talked about the 0.25 depth. We actually don't have to go very deep to stimulate collagen on her skin. Collagen is formed in the top 0.6 of the skin. So even though we are only at a 0.25 here, the growth factors are signals. The growth factors in the serum are able to drive the signal deeper into the skin so that she gets a really great result with it. And that also will help us manage inflammation.
That SYNPLA is completely stable because it's not animal derived. So It'll last, it's got a 2 to 3 year expiration date. You just keep it in your cabin, capped up, you're fine.
Oh, Michael, can you talk about how much product is in a vial?
Yeah, so what would you say you dispense? Maybe a
This-
mil and a half?
This was probably 2, and it's way more than.
Yeah.
I'm not even at 1.5,
Right.
and this was a 2.
You're going to get about at least 30 applications out of a set. So each vial is between 6 and 7 ml. So you'll get 30 applications out of a set.
You need a very small amount. Although it's a very fluid serum, it has a really nice silky feel to it, and it stays on the skin. It stays on the skin. It doesn't dissipate very quickly. You can see afterwards I'm not adding any more. I'm just redistributing that serum there. Even here, you can see how nice her skin looks here from the serum.
A lot of hyaluronic acids that are on the market are very thick gel type products. We really spent a long time, like a year, formulating something where the viscosity was thinner, so you can get a more fluid, silky delivery.
Yeah. So here I'm just almost at. I've only used about not even 0.5, and I'm almost done with her whole face.
It's scary how little you need, isn't it?
Yeah. Yeah.
And we're not putting just like 0.001% of growth factor. It's a 3% complex. It's loaded with the 23 amino acids in a chain of about 380 different links. So you're just getting a tremendous amount of firepower down to the fibroblasts that are going to stimulate new cell growth. Because new skin is what you need to have it to be wrinkle-free, hyperpigmentation-free, and free of acne even, believe it or not.
Cost per treatment, I forget what we said about that. The cost per treatment on this is very low for all the modalities that you have in here. It was like, Elizabeth, what was the cost per treatment on this when we calculated it?
Right.
Hello, everyone.
So we're looking at, as far as the hydro serums, our serums are going to be about $8 a treatment, what you're going to use in the device. And then the nano serums, the cost is how much?
$15 for your tip.
So we're talking about $23 total.
M.A.D products?
Right, M.A.D products.
Right, so you're probably with the growth factor, which is the most expensive. Again, you're only using about a mil. You're probably in the $15 to $17 range total from everything, from the chemical peel to the cleansing to the extraction, fraction, to the growth factors, everything.
And really, I mean, you're going to be able to get at least 10 to 15 treatments without having to purchase any additional product. And then once you have to purchase something, the only thing you're going to have to purchase is a bottle of hydro serum. And
You'll probably get 25 to 30 treatments in the M.A.D stuff, so you're not going to purchase any M.A.D stuff for a long time.
a bottle of
Yeah.
that's it.
Treatment time is about 90 minutes.
Yeah.
Right?
Yeah.
Treatment time is about 90 minutes.
What would you say the value of this protocol is? Like, if you're when you sell this protocol with all these different modalities?
I think the best way to talk about it is, I'm going to take this off. So I think the best way to talk about it is to think about individual treatment, what the cost is in individual treatment. Now, Carla, if you were just doing a nanochanneling treatment, how much you were still working for it? So how much do you charge for something like this?
So microchanneling for like a full face like this would start at $350.
So that would be $350 just for microchanneling.
Just for microchanneling.
Okay, so a hydro treatment like the one that you saw is going to go anywhere by itself. Just hydro and just some no nano channeling, somewhere around $125 to $175. Okay, and a M.A.D facial.
It's about that, 150 to 175.
So all in all, if you were doing each of these things separately, we'd be talking about somewhere in the realm. Yeah. Okay. We'd be talking about somewhere in the realm of around $700, right?
You guys can
I don't
see
know if
really
my math
quick.
is right, but I think I'm close. Somewhere around $600-700.
Okay. So,
and then,
hang on, sorry. I just
Sorry,
want to
go
show
ahead.
you the tip, how it fits really nicely here, side of the nose, and all the way up here, like close to her bunny line.
don't you guys love that it's a triangle tip? That makes such a difference. It really is.
All right, sorry. Go on.
Honey, that was very important. So yeah, so like the
Have you
total
sit
of
here
this
with me?
treatment, if you were to do them individually, would be somewhere around $700. I would probably price this no less than around $400 to $500 per session. Okay. Now I do have some people that hesitate. They're like, I don't think I can charge that, and it's not a hard number, but it is a. You can start somewhere and then have somewhere to go once you have the clientele. The great thing is that your cost per treatment is so low that you really have the ability to play. And once you have this stuff, I mean, there is no need for more. Sorry, go
I'm
ahead.
just going to show you. Like I used about 0.75. I'm going to apply the
A little bit more.
More
You'll
on the
be at
skin?
1 ml.
Yeah.
Yep.
Yeah, so you'll get 30 treatments per box.
I wanted to do it this way. You can also use it directly from the bottle, but I wanted to do it this way so you guys could see exactly how much is
Yeah,
being
that was an
used.
excellent visualization on how little you use.
And you certainly could use it this way. Just draw it. Actually, it would make your client be like, oh my god, it's so fancy. What's that? You know? You could use it this way, and it also will help with if you're worried about cross contamination. So you just draw from the. Oh, good stuff.
So she is done here, and you guys can see she's pink. The pink, can last a few hours, less than an hour. It just depends on the client and their skin. But she looks like she's, has she's been a little sun-kissed, but she's not super red or bloody or anything like that. She's nicely stimulated.
Wait till she feels what we're gonna do next.
So look at that. Even after I reapplied this, I still have 0.75 left. And I put a lot on just because I have it. I have it. You want me to just put it on? You want to save it for after? We can give it to her. After. Okay. Can you hold on to this for her?
Nice.
Okay. So now the next step, you're going to love that one.
Yeah. I got you.
Okay.
Good catch.
Lovely and stimulated. I'm just going to talk loud while I get the mic
Here, get the microphone ready. We're going to turn on the cold therapy on the device. But it is what it is.
You look adorable.
Of course I do. So I'm going to put on my gloves. Could you open that for me, Carla? And we're going to use the amazing M.A.D Platinum Hyaluronic Mask, which is incredible.
This mask is created. It's a great add-on for any matte facial or any facial you do, and it's especially effective following this multimodality treatment because it is going to again release more hyaluronic acid and a couple of other interesting ingredients, some tremolo mushroom, which is an anti-inflammatory extract. So get a good look at her skin tone now and what's going to happen after Elizabeth does her magic.
So this has just been sitting here, but it feels cool to my hands. You could also put this in the fridge if you wanted a little extra of that cooling. So if you have one of those little mini fridges, it'd be a great idea. But if not, it's going to feel nice and cool. We're also going to cool it down even further with our cold therapy, which is what I have turned on right now. So I have it turned on, and I'm just allowing the handpiece to cool down a bit while I get this applied. And what you want with this is just as much contact as you can get with the skin. It's not the most beautiful application, but it works. All right.
I heard you can make ice cream with this too.
This, so it's going to be cold. How does that feel?
Better.
Better?
So what's the cold doing?
So what we're doing is we're vasoconstricting. So we are helping to reduce redness and inflammation by drawing fluids away from the surface of the skin. We're doing that by using cold temperatures. So the benefit of this, it has a dual benefit. One, that we're going to help the skin relax, calm down, reduce a lot of redness, help reduce inflammation. But there is a secondary effect that I love with cold therapy that we don't think about. It's that as it's drawing those fluids away from the surface of the skin, it's also creating this vacuum effect that is going to allow us to get deeper penetration of our actives that we've placed on the skin, especially with the channels that we've created with the microchanneling. In addition to that, the secondary effect, once the skin comes down to its regular temperature, then you're going to also get a really, really nice flood of nutrients and fresh blood to the skin. So it has a lot of benefits that we don't think about. That's more than just it being cold to the touch. But this is not icy and freezing. This is just cool and refreshing, and it feels really good, right? And I think this is a part in the treatment where your client actually gets to relax and enjoy. You know, a lot of times when we have these medical grade or really intensive multimodality treatments, they're extremely functional and they're going to get beautiful results and you're going to get amazing results for your client. But what will happen is that they can be like not that relaxing, you know, and that's okay, you know. But when you can add a little bit of relaxation and refreshment to the skin, it's really going to be helpful and beneficial for the client. Now, Michael, this has a lot of hyaluronic acid, and I kind of want you to pass this around so they can see how much is still left in there.
Yeah, so the great thing is that there's plenty of juice, as I like to say, in the bag. Don't waste it. Apply it on the neck, the décolleté, hands, and anywhere. Feel free. If you open that up, you'll see plenty of juice in there. If you want to squish some out and try it, you can. You may want to tilt it upside down a little.
Yes.
Yep.
So I will be at the ESI show in Vancouver. Yes, friends. We will be with our amazing Canadian distributor, Spivaro.
Are you going to market the name
Not much.
Miami facial?
No, we'll be marketing a different facial, actually exclusive to Vancouver.
No, I mean the name of it so that if people sees it.
Yes, we are. So our model had a really good question. She was like, "Are you guys going to market this Miami facial so people, when they see it, they know what it is?" And I said, "Yes, that's the whole purpose of this, is to have a real particular protocol." All right. So I think we've done this.
We carry the Platinum Miami facial.
Definitely. So I'm good with this?
Yeah,
We're good?
Yeah.
So normally I would leave this on her skin for probably 10 minutes or so.
Yeah.
We've had it on here for about 5 to 7 now. For purposes of time, I am going to remove. And under normal circumstances, when we do channeling, we do not apply anything else on the skin, right? Because we have those channels open. Let her talk into the mic.
Yeah, so after microchanneling, you want to keep the skin clean. The mask is perfectly fine, but just want them to keep their skin clean for the next several hours or at least until the next morning would be even better.
Yeah. And then just have them return to their normal skincare routine in 24 hours.
So in 24 hours, yes. Next morning, they can start their normal skincare routine without actives for about
So
5 to 7 days.
So no acids, no retinols for 5 to 7 days post. Okay? Now, you remember what her skin looked like when we applied this mask, right? Do we remember? Nobody remembers? It was a little pink, a little bit red, a little bit inflamed. Now watch the magic. And again, you want to leave this on a little longer if you can. You can even have the client go home in this if you really wanted to. Okay? She's still a little bit pink,
On the cheeks.
but she's perfectly, all that redness that we had is reduced. And again, a little bit of redness, a little bit of of that stimulation that we have is okay. That's part of the purpose of the treatment. But by tomorrow, she's going to be fine. Actually, she's going to be
Couple
glowing.
hours.
I did this on myself last week, and the next day, the glow that my skin had was unbelievable. So it's really awesome. I'm not going to mess with her skin. I'm going to let her kind of absorb and sit with this hyaluronic acid on her face. It's going to feel good. It's going to refresh her. And whatever was left in the syringe, I gave to your partner here so that you can apply it if you need to apply it later on. Okay? All right. So that's it. Thank you guys so much. We have our next demo starting in about 4 minutes. So we're going to have a pigment therapy demo with Jermaine DeCappuccini. Bye, Instagram. Bye, Instagram. Love you guys.